This is interesting case of coronary artery disease with right ventricle infarction, where the inferior wall infarction is very minimal, so easily missed, but the patient has history of chest pain. At the same time, troponin test was also positive. So search results showed the right ventricular infarction along with very small portion of inferior wall infarction. In this image, you will miss the inferior wall infarction, but in a still frame you will analyze, you will see this portion. This is interventricular septum, this is right ventricle, this is left ventricle, and this portion is akinetic. So you see the portion, this portion. Just trace this wall, you will find this wall. This wall is almost, you can say, minimally aneurysmal. One moment, you can better appreciate. See this wall. So this one. Now you can see this one. Now see this one. This portion is minimally aneurysmal. You can see this is interventricular septum. The septum is coming like this, then going like this. What is this portion? This portion is minimally aneurysmal, you say. So this is the case of inferior wall infarction along with right ventricular infarction. If you focus on right ventricle, this portion is hypokinetic. This apical portion is having normal motion. This apical portion has normal motion, and this part is hypokinetic. So this case has got right ventricle myocardial infarction. At the same time, right ventricle and right atrium severely enlarged. This is right atrium and left atrium. This is right atrium and this is left atrium, and there is no ASD in this image. Image was recorded to show you no ASD is present in this case. You can see the motion of right ventricle. Here you don't find any inward motion. No inward motion is there. So there is basal and mid right ventricle free wall is hypokinetic, indicating right ventricle myocardial infarction. Now you see, focus on this portion. This portion has got hypokinetic area. You can easily see this portion is hypokinetic. This is right ventricle and this is left ventricle, and this portion is hypokinetic, and this portion is also hypokinetic of left ventricle. So this is the basal portion of inferior wall, and this is basal portion of right free wall, right ventricle free wall. This is almost akinetic in this view. So ultimately this case is the case of right ventricular infarction along with inferior wall infarction. Now you can see apical fourth chamber view. This is left atrium, left ventricle, right atrium, right ventricle. Right atrium, right ventricle is moderately dilated. Minimal TRZ without any raised right ventricle systolic pressure, indicating right ventricle myocardial infarction. Whenever there is pulmonary artery hypertension leading to enlargement of right atrium, right ventricle, in that case TRZ will have higher velocity. But in case of myocardial infarction, the velocity is quite less and there is no significant pulmonary artery hypertension or no significant right ventricle systolic pressure rise. That is the point to know. Now you see this portion is akinetic. This portion akinetic. This is thoracic aorta. You see, this is thoracic aorta coming in view. Thoracic aorta just behind the left atrium and left ventricle also in this image. Again the same thoracic aorta, along with, you can see this portion is akinetic. So ultimately this case is, you can see the minimal TRZ. So this case probably had right coronary artery blockade. In this image, what I have shown you, very small this portion. This portion is very small. You see this portion. You can see minimally enlargement. Only thing I want to show highlight in this apical fourth chamber view, right atrium, moderately dilated. There is no ASD. This is aorta and this is IVC. IVC is minimally dilated, not that much. You can see the TRZ. This is flow across tricuspid valve. The velocity measured is 201 centimeter per second and peak rate is only 16 millimeter mercury. So no significant pulmonary artery hypertension. You can see the right atrium, right ventricle dilated. Left atrium, left ventricle is not dilated. So sometimes you have to focus on to find out right ventricle myocardial infarction, because patient will have chest pain, history of syncope or low blood pressure after myocardial infarction. If you give sorbitrate, nitrates to relieve the pain, patient will have fall in BP. In case of right ventricle myocardial infarction is significant one. So only thing that has to be remembered through this video. So focus in the most basal portion of inferior valve. Thank you.